I'm a fourth year medical student, and I've just completed my SSM in Derby in anaesthetics. I had the most amazing time. So it's kind of sparked a bit of an interest in anaesthetics. So hopefully will be a colleague at some point in the future. As part of it, I did this presentation on greener anaesthesia because it's just such an important, very topical topic at the moment, given the current climate. Excuse the pun. So kind of for completeness, just want to start by defining the greenhouse gases. So they make the Earth warmer by trapping energy inside the atmosphere. These include gases such as water vapour, carbon dioxide, methane, nitrous oxide, chlorofluorocarbons like isoflurane, ozone, and hydrofluorocarbons like SIVO or desflurane. The effect of a greenhouse gas on climate change depends on three factors. So firstly, how much is in the atmosphere. Secondly, how long it stays in the atmosphere. And finally, how strongly it impacts the atmosphere. There's something called a global warming potential. I'll just cover it on the next slide. Has been calculated for each gas to reflect how long on average it lasts in the atmosphere and how strongly it absorbs energy. So stronger absorption leads to a higher GWP and therefore contributes to more warming. So the global warming potential is a common unit of measurement which allows comparison of the global warming impact of gases. So it's a measure of how much energy the emissions of 1 tonne of gas will absorb over a given time period relative to the emissions of 1 tonne of carbon dioxide. And this time period is normally taken as 100 years. So the problem with anaesthetic gases, the NHS estimates that 5% of the total carbon footprint of an acute NHS trust is attributable to anaesthetic gases. And of that 5%, it's estimated that desflurane contributes 80% of the greenhouse effect, which is an insanely significant value for one gas. Furthermore, anaesthetic nitrous oxide is said to contribute 1 to 3% of all global nitrous emissions. We can use the GWP of the anaesthetic gases to compare the environmental impact. So as shown, per mass, desflurane has a GWP of approximately 20 times that of SIVO and 5 times that of ISO and 10 times that of nitrous. So this means that 1 gram of desflurane will absorb the same amount of emissions as 2,540 grams of carbon dioxide in 100 years. It's just a massive figure, that. We've talked a bit about the greenhouse gases and their warming potential, but I'd like to touch briefly on the ozone layer and ozone depleting potential of gases. So again, for completeness, the ozone layer acts to absorb harmful ultraviolet light to prevent it reaching the planet's surface. Some chemicals can react with the ozone in the upper atmosphere, reverting it back to oxygen, which can create a so-called kind of hole in the ozone layer. Lots of people may remember the hole in the ozone layer above Australia. So this can allow more ultraviolet light to reach the Earth's surface, leading to a higher risk of sunburn, faster aging of the skin, and a greater number of skin cancers. As for gases with ozone depleting potential, albeit kind of fairly obsolete now, but halothane has an ozone depleting potential and nitrous oxide as well. At present, anthropogenic nitrous oxide generation is responsible for the most ongoing ozone depletion. One of the pros of SIVO and desflurane is that they have no ozone depleting potential. However, as already discussed, they have their own environmental complications. So personally, I find it really frustrating when people explain the problem but don't offer any reasonable solutions. So here are a few. So firstly, when possible, avoid nitrous oxide. As discussed, it's got a significant ozone depleting potential and global warming potential, and it's recommended that nitrous oxide should be reduced to cases where it may reduce morbidity and mortality over alternative drugs. Furthermore, I would argue that there's very little to gain using desflurane, because I like a rhyme, but especially considering the significant environmental impact. A big win for sustainable healthcare, though, with support from the Royal College of Anaesthetists and the Association of Anaesthetists. The NHS has committed to stop using desflurane by early 2024, which is brilliant for sustainable healthcare. Again, another potential solution is to consider increasing use of TIVA. Unlike the inhaled drugs, the greenhouse gas of propofol, impacts of propofol primarily stem from the electricity required for the syringe pump and the waste from preparing the drugs, but not, from direct production of the drug or direct release to the environment. Furthermore, TIVA confers many advantages over a conventional volatile technique, particularly a better recovery profile with reduced risk of post-operative nausea and vomiting. Risk of awareness during general anaesthesia can be mitigated with effective education and training, according to a study by Al Rifai from the BJA in 2016. Additionally, there's been a huge push to encourage increased use of regional anaesthesia. So unlike general anaesthesia, it doesn't use volatile halogenated agents, which have significant greenhouse gas effects. And moreover, evidence from a real-life example of hip knee replacements at a New York hospital suggests that regional anaesthesia provides more effective pain relief, has fewer unpleasant side effects, shortens hospital stay, and may actually be preferred by patients to general anaesthesia. And my final two is we all know it's really important to try and reduce waste in the hospital, but especially pharmaceutical waste. Pharmaceuticals make up 20% of the NHS carbon footprint. So examples of good practice are drawing up drugs as you need them, and avoiding drawing up drugs just in case. Last but not least, if you need to use volatile agents, the Association of Anaesthetists recommend using low flow anaesthesia, maximum 1.5 litre per min, during maintenance in all cases. Also, environmentally, sevoflurane would be recommended for use over desflurane due to the significant difference in global warming potential. So here's kind of a little bit of almost references, but also just useful articles that I've included in my presentation. And much of this information on this PowerPoint is adapted from GASP, which is a greener anaesthesia and sustainability project. They have so much more information on their website. And if you join the community, I think you get a lanyard. And it's just a really good way of kind of seeing what we can do to kind of make a small impact.